Hello everyone, welcome back to the channel. In today's video, we are going to understand the pathogenesis of tuberculosis caused by Mycobacterium tuberculosis in a very simple step-by-step flowchart format. And tuberculosis is one of the most important infectious disease worldwide and remains a major global health problem according to the World Health Organization. And in this video we will cover how tuberculosis infection begins, what happens inside the lungs after the inhalation of the bacteria, how the immune system responds, formation of granuloma and caseous necrosis, then the difference between latent TB and active TB, and finally how tuberculosis spreads to other organs causing extrapulmonary disease. So if you are a medical student preparing for microbiology, pathology or USMLE, this video make the entire process very easy to understand. Let's start with the first step, that is exposure to Mycobacterium tuberculosis. Tuberculosis begins when a person inhales aerosolized droplets containing MTB or Mycobacterium tuberculosis released from an infected person through coughing or sneezing or speaking. Okay, so exposure by inhalation of aerosolized droplets containing Mycobacterium tuberculosis, and this leads to infection. And this Mycobacterium tuberculosis travel down the respiratory tract. Okay, they travel down the respiratory tract and deposit in alveoli. And this can induce an initial immune response, that is phagocytosis by macrophages, alveolar macrophages. So there is an initial immune response. What is that? There is phagocytosis by alveolar macrophages. Okay, and after this it can enter two paths, that is the macrophage can destroy the Mycobacterium tuberculosis. Macrophage destroys the Mycobacterium tuberculosis, or the Mycobacterium tuberculosis survives and multiplies inside the macrophages. Okay, the MTB multiplies and survives inside the macrophages. And the pathophysiology behind this is that Mycobacterium tuberculosis can inhibit the phagosome lysosome fusion, that is the phagolysosome formation. Phagolysosome formation, MTB can inhibit the phagolysosome formation. In those people, the MTB multiplies and survives inside the macrophages. And in these people, then a cell-mediated immunity develops 2 to 8 weeks post-infection. Okay, cell-mediated immunity develops 2 to 8 weeks post-infection. Okay, so what is the cell-mediated immunity which develops 2 to 8 weeks after? So here the macrophages releases these macrophages in which the Mycobacterium tuberculosis multiplies. These macrophages, they release cytokines. Okay, which are the cytokines? They release interleukin 12 and TNF alpha, and these activate the T helper cells. Okay, T helper cells by binding to CD4 plus, and these T cells release interferon gamma, which activates the macrophages, activate the same macrophages and also recruit more macrophages. Okay, macrophages become highly active, and also the macrophages can secrete TNF alpha and recruit more and more monocytes, which later becomes macrophages. So macrophages become highly active, and then after the macrophages become highly active, there is granuloma formation. Granuloma formation. It is also called tubercle. Okay, tubercle. And here the immune system walls off the infection, and the activated macrophages form epithelial cells. Activated macrophages form the epithelial cells, and some epithelial cells fuse to form multinucleated giant cells, which are called Langhans giant cell in tuberculosis. Langhans giant cells. And these activated macrophages and giant cells, they surround a caseous necrosis, central area of caseous necrosis. So this is a central area of caseous necrosis which is surrounded by activated macrophages. These are the activated macrophages, and also Langhans giant cells are seen. Langhans giant cells, and all of this surrounded by many small lymphocytes. These are small lymphocytes. This is what we call as a granuloma. Okay. And after the granuloma formation, this TB can become latent tuberculosis or primary progressive tuberculosis. Primary progressive tuberculosis. The latent TB happens in almost 90% of the people, and primary progressive stage happens in 5 to 10% of the people, and usually children and immunocompromised people. Latent TB occurs mostly in immunocompetent people. And here in latent TB, the immune system successfully contain the infection. They successfully contain the infection. Actually, in latent TB, the bacteria, Mycobacterium, actually lives in the caseous necrosis, and it is surrounded by these inflammatory cells that are macrophages, giant cells, then lymphocytes. Okay, these successfully contain these bacteria in the granuloma, and it prevents it from dissemination, and the bacteria goes into a dormant state in which the bacteria is inactive and does not cause any infection. But in primary TB, the immune system fails to contain the bacteria. Okay, fails to contain the bacteria. That can lead to active pulmonary tuberculosis. Active pulmonary tuberculosis. And in these people, symptoms appear. Okay, the symptoms which are typical of tuberculosis, like cough, fever, night sweats, etc. Then weight loss, then hemoptysis, that is coughing of blood. Okay, coughing of blood. These are the classical symptoms of tuberculosis. This develops in primary progressive tuberculosis, and in these people in which latent stage of TB occurs, in them the granuloma enlarges. The granuloma undergo fibrosis and calcifies. That is called gone focus. Okay, and bacteria goes dormant. That is, the bacteria cannot cause infection, and it is not also contagious. The patient is asymptomatic and non-contagious in latent infection. And non-contagious. That is, the person cannot transmit the infection to another one during this stage. But when the same person, the bacteria is actually staying dormant in that person, but when there occurs an immunosuppression. Okay, when the immunity of that person goes down, like as in HIV, in aging, as a part of aging, in malnourished people, then in diabetes mellitus, in people who are taking steroids or other biologic drugs. In these people, actually these dormant bacteria, they actually reactivate. Okay, reactivation, or that is called secondary tuberculosis. Okay, secondary tuberculosis. The dormant bacilli wakes up and the granuloma cavitates and rupture. Okay, granuloma cavitates. In X-ray, you can see many cavities in the apical lobe of the lungs, in the apex of the lung, and these can actually rupture and the bacilli spill into the airways. Okay, spill into the airways, and that can lead to complication, that is dissemination. Dissemination, and these complications can occur in both secondary TB and also primary progressive TB. These bacilli can spread locally and systemic through hematogenous route. So if the bacilli spread locally, if they spread locally, they can cause extensive lung cavitation. Okay, many cavities form inside the lung, extensive lung cavitation. And if they undergo systemic spread by irrigation of granulomas into blood vessels or lymphatics, okay, through blood vessels or lymphatics, this is called, the systemic dissemination is called miliary tuberculosis or extrapulmonary tuberculosis. That is the disseminated form of tuberculosis. These bacilli can spread to other organs like lymph nodes and cause lymphadenitis. It can spread to pleura and cause pleural effusion. It can spread to CNS and can cause tuberculous meningitis. Okay, and these can even spread to bone and spine. If the bacilli spread to vertebra, it is called Pott's disease. And these can also spread to kidney, GI tract, liver and pericardium. Okay, GI tract, liver and pericardium. So this is the pathophysiology of tuberculosis. Okay, first there is an exposure, then infection occurs, then if the initial immunosuppression, that can lead to complete destruction of bacilli, or there is a cell mediated immunity that leads to granuloma formation. And in some people, after the granuloma formation, latent TB occurs in 90% of people, and in some it can progress to primary progressive TB. In those, classical symptoms appears, and in those people with latent TB under immunosuppressive conditions, these can reactivate and leads to more cavities and also disseminated form of tuberculosis. It can occur in both primary progressive tuberculosis and secondary tuberculosis, and this can disseminate locally to form extensive lung cavitation, and it can spread systemic through blood vessels or lymphatics to form miliary or extrapulmonary tuberculosis that include lymphadenitis, pleural effusion, tuberculous meningitis, Pott's disease, osteomyelitis, then renal tuberculosis, intestinal, it can spread to liver, pericardium, when spleen, adrenals. So most of the organs in our body can be affected by tuberculosis. So that was the complete step-by-step pathogenesis of tuberculosis. If you found this explanation helpful, make sure to like the video, share it with your friends, and subscribe to the channel for more simplified YouTube videos for medical students. Okay, thank you for watching, and I will see you in the next video.